I'm Dr. Jordan Williams. I've been in practice for just about 2 years now. Graduated from Cleveland University in Kansas City, practiced in Billings, Montana. And when I first came out of school, I joined a group. We have 6 doctors in 6 different offices, and some of us are kind of spread out between a couple different offices. And it's been great. I've got a lot of experience that I can contact with if I have questions as far as patient care and patient management. I've been able to reach out to the doctors with a lot more experience. But in that time, we have 6 very different personalities over 6 different locations, and we kind of we're spread out as far as our mindset and where we wanted our practices to go. And so we've been looking for a way to congeal, to come together, to find common ground as doctors and what we want for our patients. And in that journey, we found AMC through some friends who've been part of AMC for some time now. And in that short time, which has been about 4 months, we've seen a big change in the overall culture of our practice, not just the doctors, but the staff as well as the patients themselves. We are more focused on chiropractic during our time with the patients. We've seen changes as far as what the patients want out of chiropractic. They ask more questions directly related to what we're doing and why we're doing that. I had a couple patients that I'd seen for months, coming up on a year or a little more, that had never referred a single patient. And since joining AMC, I've had that patient give 2 or 3 referrals, who in turn, those referrals have referred their families. And I think, I can't count the number, 8 or 9 referrals last month directly from those referrals. And so it's been great to see the changes, be more focused on our purpose in chiropractic and not just hoping for the best and trying to figure out how 6 personalities can work together in one small space. AMC is set up in such a way that if you don't ask for the referral, it feels like something's missing. It's part of the conversation from the beginning. And I think the patients feel that as well as they come in. They know there's something more to chiropractic because of how it's presented, because of how you're educating them through the process, and they want to refer the people they know need that. Everybody has a friend that needs chiropractic. They just don't know how to bring that conversation up. There's so much depth to AMC because it's principle based. Yeah. And when it's a principle, there's a layer and a layer and a layer, and it keeps going deeper. And I came out of school fairly recently, light on philosophy, light on what we actually do as chiropractors. And AMC has the full package of patient management, how to run a practice efficiently, but also why we're chiropractors, what we do, and what we can do for our patients. We've just scratched the surface. I think there's a lot more to what we're going to see out of our practices. So for me, AMC has been an answer to prayers. It's been an answer to a search to figure out how to be the best chiropractor we can be in Billings, Montana, or the surrounding area, and just anywhere we're at.